Thank you, everyone, for joining our Oscar Care Group Elderly Nutrition Myth Busting webinar. My name's Sarah, and I'm an accredited practicing dietitian located in New South Wales. With Oscar Care Group, we have dietitians all around Australia. So, firstly, how many times have you Googled something, seen something on social media, or by a celebrity or an influencer, and you're still unsure of what the answer is? Dietitians are a reliable source of evidence-based nutrition, and we're always here to help. Thank you all for submitting your questions. We've received an overwhelming amount of myths, and some were too complex to explain in this webinar. So we will be releasing some blog posts in the coming months, so please stay tuned for that. And all the myths today that we will be covering will be focusing on nutrition for older Australians, so 65 plus, within residential aged care settings, or some myths do apply to older residents still at home, and some are aged care specific. So we'll dive into our first question. So the first myth is that older people don't need to eat as much. Now, this is true to some degree. So as we age, our body's energy requirements may reduce, but often the protein requirements and other nutrients are increased. The reduction in energy is often because we lose muscle mass in our senior years and we don't do as much physical activity. And on the other hand, we might have increased needs for protein and other nutrients with wound healing, infections, surgeries, and other conditions that we might encounter with age. So people might also think that we don't need to eat as much because we might lose our appetite or the ability to recognize hunger cues. So it's important to focus on eating nutrient-dense foods, such as colourful fruits and vegetables, lean protein, whole grains, and dairy. So it is more quality of what they are eating rather than the quantity of food. And older individuals do require greater amounts of protein, calcium, vitamin D compared to adults. And the protein requirements increase further with stresses on the body, such as infections, pressure, injuries, wounds, cancer, and liver disease. So elderly bones also tend to lose calcium. So while a diet high in calcium does not reverse age-related bone loss, it does slow down the process. So those over 70 years old require 1,300 milligrams of calcium, and calcium deficiency may lead to osteoporosis, which is a disease that affects both men and women, where the bones become brittle or fragile, and it's important to include a variety of calcium sources to help prevent this. So these are some food sources of calcium. So we can have a 200-gram tub of yogurt, 200 mils of calcium fortified soy milk, a cup of steamed broccoli, half a cup of salmon, usually the canned salmon with the bones in it, about 15 almonds, a cup of fortified breakfast cereal, or half a cup of fortified orange juice. And then some sources of vitamin D include fatty fish, salmon, tuna, sardines, fish liver oils such as cod liver oil, orange juice fortified with vitamin D, dairy and plant milks that are fortified, beef liver, egg yolks, and some cereals are even vitamin D fortified. So there are also calcium and vitamin D supplements. Before taking a supplement, we always have to discuss this with our doctor. So the next myth is that losing weight is a normal part of aging. And this myth is false. So how many times have you heard a person say, I should lose weight as I get older? So whilst weight loss may occur in older people, it's definitely not a normal or expected part of aging. So it's essential for us to keep an eye on someone's weight. This is usually done monthly, and it just ensures that they are staying within a healthy weight range. And so we will dig a little bit deeper into why people might think that aging is a weight loss and aging go together. So it's important to recognize the various factors that can contribute to weight loss, such as changes in metabolism, changes in appetite, and the body composition, and of also other conditions and illnesses. So we do need to address any significant or unexplained weight loss, and always consult your dietitian or doctor to rule out any potential health concerns and also to prevent malnutrition. Up to 50% of residents in residential aged care facilities are malnourished, and malnutrition is definitely it's a deficiency of nutrients and such as energy, protein, vitamins, and other minerals. It can cause adverse effects on the body composition, function, or clinical outcome. So, and there are many consequences as a result of malnutrition, such as reduced mobility, confusion, infections, an increased risk of fractures or falls, reduced independence, low mood, low energy levels, muscle wasting, and increased hospital visits or stays. So it's important that we all work together to reduce the risk of malnutrition. And if you are maintaining a healthy, balanced diet and meeting the nutritional requirements as you age, an older person should be able to regain weight or maintain their weight throughout the years and into their elderly age. So the next myth is every resident needs a supplement. Now, this myth is false. So as a dietitian, I'm here to tell you that not every resident needs a supplement drink. Firstly, you might ask, what are these supplements that I'm talking about? So commercial supplements are usually found in Tetra Paks, bottles, or powders that one can drink. And I'm not sure if you've ever tasted a commercial supplement, but many of them are quite rich, sweet, and concentrated, which means some residents do not enjoy them as much. So as dietitians, we recommend a food-first approach to enhance the taste of food and focus on quality of life and enjoyment of food. And then supplements are often the last resort. So if we do find a resident that has reduced appetite, poor oral intake, or weight loss, there are many ways to increase the energy and protein in their foods before considering a supplement. Some ways that we can increase the energy and protein of foods is using yogurt, giving them cheese and biscuits, custard, ice cream, Milo, milkshakes as well. So giving those between mid-meals can help increase the daily intake of their energy and protein. We can also fortify the meals by adding additional cream, milk powder, butter, oil, cheese, which often make them tastier as well. So there is still a place for supplements, and they can be valuable role in certain situations where a resident is unable to meet their needs through food. But supplements are often required for fewer residents, and not every resident will need them, as we do aim for a food-first approach. So the next myth is that older people don't need to eat their greens. And this is false. So our green vegetables are still just as important for older people as they are for any age group. Green leafy vegetables such as broccoli, kale, spinach, and other vegetables are packed with a range of vitamins, minerals. They have a source of fiber as well as antioxidants. So vegetables are one of the 5 food groups, and it's recommended that older people eat 5 serves of vegetables per day. So an example of a serve of vegetable could be a cup of leafy greens, half a cup of broccoli, spinach, carrots, or pumpkin, or half a cup of canned beans, legumes, and there are many ways to include vegetables throughout the day in an aged care home. So some of these can be having baked beans at breakfast, or having an omelette with some spinach and tomatoes at breakfast as well. With lunch, you can have either a side salad or some cooked vegetables with the main meal. And then for dinner, you can put some vegetables into a soup or legumes, such as chicken and corn soup, pea and ham soup, or minestrone soup. So if we do have an older person that doesn't like their greens or aren't fond of green vegetables, we can still explore alternative options and still provide similar nutritional nutritional benefits. But the key is to encourage a diverse range of vegetables in all colours. And our Oscar Care Group dietitians will be releasing some great tips in the coming months on how to include vegetables in our day. So the next myth was that it's impossible to maintain muscle mass as we get older. Now, this one is false. So maintaining muscle mass as we get older is indeed possible. Muscle mass plays an important role in our overall health and well-being. It supports mobility, balance, and helps us perform our everyday tasks. Movement is also important. So as we reduce our mobility, we tend to also lose muscle mass. And from the nutrition side of things, protein plays a key role in maintaining muscle mass as we age. Our bodies may require a slightly higher amount of protein. These can be found in lean meats, poultry, fish, dairy and alternatives, or legumes. And some examples of a serve size could be 65 grams of cooked lean meat, such as beef, lamb, pork, or veal, about 90 to 100 grams of raw kangaroo, or 80 grams of cooked lean poultry, such as chicken or turkey, 100 grams of cooked fish, or one small can of fish, and then either 2 large eggs or a cup of cooked legumes or beans. You can also use 170 grams of tofu or 300 grams of nuts, seeds, or peanut butter and those types of things. But just making sure that when you are using these spreads, making sure that they're the low salt alternative. So everyone does have different protein requirements. So you can always consult your dietitian if you want to determine the individual protein intake, as it may vary with specific conditions. Now, the next myth is that people can maintain strong, healthy bones. And this is true. And the key players in bone health are calcium and vitamin D. So these can be found in dairy and alternative products, leafy green vegetables, and fortified foods, as we talked about earlier. Vitamin D also does come from the sun, and some older people aren't able to get outside as much, so additional supplementation may be required in those people as well. And as we covered earlier, these are some great examples of calcium and vitamin D from our foods. And it's always important to speak to your doctor if you do think you may need a calcium or vitamin D supplement. So the next myth is that older people want bland food. Now, this myth is false. So the belief that as we age, our taste buds fade and all we want is flavorless food is in fact false. Older people still appreciate and enjoy a diverse range of flavors in their meals. And some older people may experience taste changes due to with certain foods and medications, which may change what they enjoy eating. but they also may require less salt due to heart conditions. But it doesn't have to mean that we have to compromise on flavour for them. So these are some ways that we can enhance flavour without relying on excess salt, such as adding herbs, spices, garlic, onions, lemon zest or vinegar, certain garnishes, sauces, and pepper as well. So they can all improve the smell, taste, and visual presentation while keeping food as an enjoyable experience for the residents. So the next myth is repetitive menus are acceptable as older people won't notice. So this myth is false. So it's actually not acceptable due to taste fatigue. We recommend a seasonal 4-week menu with regular changes and always including resident feedback and their preferences. So offering a diverse menu can provide a range of nutrients, flavours, and cultural diversity, which often increases oral intake and appetite for older residents. Food that reflects their cultural background can act as a source of comfort, and it can play a role in recovery from illness and also adaptation to a long-term care setting. And a dietitian's input is required for all seasonal menus, and a menu and mealtime quality assessment is recommended twice per year as per Dietitians Australia. So the menu and mealtime quality assessment is the gold standard, and an on-site assessment and the dietitian's recommended opinion. It has been developed by Dietitians Australia and for the exclusive use by accredited practicing dietitians to provide your aged care home with expert assessment and recommendations for their residents' nutritional care, menu, and the mealtime experience. So this assessment uses the aged care quality standards as a framework. You might want to know what it involves. So it includes an on-site visit by an Oscar Care Group accredited practicing dietitian, and they'll come out to your residential aged care home. We'll interview with relevant staff, complete an assessment of the menu, observations of meal service, weighing samples of different components of the food, and review the documentation, for example, the policies and procedures. And on completion of the assessment, you will receive a written report with expert feedback on the nutritional value of the menu, the mealtime experience, and key recommendations, and a corrective action plan to use continuous improvement plans to the specific menu, meals, and environment. So how might this benefit your home's residents? So they will have satisfaction with the food provided, which plays an important role in maintaining quality of life. A tasty and nutritious diet tailored to the unique needs of older people, which reduces the risk of malnutrition, unplanned weight loss, dehydration, pressure injuries, and falls. And it also benefits them due to their relaxing mealtime environment, which helps encourage eating and overall good health and well-being. And how would a meal and menu quality assessment benefit your home? So it's a cost-saving, food-first approach to malnutrition instead of the reliance on commercial supplements. You will have staff pride and satisfaction with the food service and mealtime environment that meets the needs of the resident. A workforce that is more aware and skilled to meet unique nutritional needs of a resident, and a menu that offers food that supports the accreditation and quality standards. So as part of this assessment, Oscar Care Group dietitians will provide you with a corrective action plan numbered according to the priority for your organisation to focus on. and the high priority items will be first. And this plan is based on the aged care quality standards. We do have more blogs on our website. There's one specifically called Mandatory Aged Care Menu and Mealtime Quality Assessments. And we will also have some new posts coming to our website as well, so you can keep your eye out for those. And our next myth is that milkshakes can be good for residents. Now, this myth is true. So these high energy, high protein milkshakes contain full cream milk powder, milk and ice cream, which contribute to the protein and energy intake of residents. Residents that require extra energy and protein may benefit from a high energy, high protein milkshake. They can be an appealing option for individuals with increased energy needs and protein needs that are finding it difficult to meet their requirements through regular meals and snacks. And it's often enjoyed by residents, and you can have different flavors such as strawberry, Milo, chocolate, caramel, blueberry, vanilla, and you can even include fruits such as bananas and berries, and these flavors can be changed daily, and it's often something that the residents do enjoy, and it can also benefit them as well. So the next myth is that older people must eat soft foods to ensure a full diet. Now, this is false. So not all older people need to have soft foods to ensure an adequate diet. They may experience some challenges with chewing and swallowing, and in this case, it's best to refer to a speech pathologist to identify what type of texture the resident needs. And the regular diet, which is the ITSE level 7, allows the benefit of enjoying food and fluid of all textures. And then as we move down the pyramid, the lower levels with softer food are usually less options to cater for residents' safety due to less chewing and swallowing. So it can become more restrictive as we go down the pyramid. So ideally, softer food should only be provided for all meals and snacks if that's what the resident needs, and it's not what all older people need. We do have ITSE training, and it is recommended for all staff in the aged care that work with food or drinks, such as nursing staff, care staff, lifestyle staff, food service and kitchen staff, and also the chefs. So Oscar Care Group offer ITSE training to best support your residents. You can reach out to us at any time to book a session. So the next myth is that it is essential for residents to eat 3 proper meals a day. Now, this myth is false. And whilst regular meals are important, and some people can thrive on 3 meals a day, it is other people may prefer smaller, more frequent meals and mid-meal snacks. So what truly matters is ensuring that residents receive a balanced nutrition and that meets the requirements for them, whether that's in 3 meals, across 6 meals, through fluids or supplements, or even enteral feeding, which is when they get a tube feed through the nose or the stomach. So everyone is different, and personalized nutrition approach will find what suits their needs. So the next myth is that a resident only requires a supplement if they look undernourished. Now, this myth is false. So whilst the visible signs of malnutrition can indicate the additional that they need additional support, it is important to have a dietitian to make an assessment and possibly meet their needs through food first, the food first approach, which we discussed earlier, and then a commercial supplement might be considered as a last resort. So there is still a place for supplements in aged care, and it doesn't have to be only if the resident looks undernourished. Other times that someone might need a supplement could be if they have reduced oral intake and other methods have already been trialed. If a resident is unwell for a short time, for example, they recently had COVID with a poor appetite, following a surgery, they might need an additional supplement for recovery. For wound healing, could also be a short time while the wound is healed. And if they do require enteral feeds, it could be a supplement that's ongoing. So it's also important for supplements to be reviewed every 3 months by a dietitian to recommend and monitor and evaluate the effectiveness of the supplement and make adjustments to the dose if required. So the next myth is that diabetic diets are used in aged care, common in aged care. And this is false. So diabetic diets are not used in many aged care homes. A well-planned, balanced menu should provide a variety, should be provided to all aged care residents, including those who have diabetes. It can be challenging to manage diabetes in an aged care setting, and it can be a balancing act between controlling blood glucose levels and optimizing quality of life while preventing weight loss and malnutrition. So if blood glucose levels are within range, it's important to not unnecessarily restrict their diet further, which can result in decreased food and fluid intake, and it can lead to a risk of malnutrition. The main goal should be meeting their dietary requirements, and older people should be able to enjoy all types of foods, including carbohydrates. So milk, yogurt, high energy, high protein sandwiches, and Milos are all great contributions to the energy and protein intake in the elderly, and restricting those further in diabetic patients may lead to weight loss or malnutrition. So always please refer to your Oscar Care Group dietitian for a personalised approach to support diabetes. And we are all different, and our blood sugar levels, normal range, can be different from one person to another. And the last myth is that it's too late for seniors to improve their eating habits. Now, this myth is false. Regardless of age, making a positive change to one's diet can have significant benefits to their overall health and well-being. So age is just a number when it comes to improving your eating habits. Some impacts of improving eating habits in seniors could be enhancing their nutritional intake. So as we age, our nutrients requirements may change due to wound healing, disease states, infections, and absorption efficiency. So improving the eating habits of elderly people may support their bodily functions and keep them to make sure they're getting all their necessary nutrients and maintain good health. Managing chronic conditions, a balanced diet plays a crucial role in managing and preventing conditions that are common in seniors. Some of these may include heart disease, diabetes, osteoporosis, or kidney failure. And an accredited practicing dietitian can help you identify areas in your diet that may need to be improved to manage these conditions, such as the balancing act with protein throughout the day, limiting salt if they have any swelling, managing carbohydrates, and increasing calcium intake. And also managing a healthy weight. So adopting healthy eating habits in seniors can help manage their weight, reduce the risk of malnutrition and complications associated with obesity. It can also help them maintain muscle mass and strength, maintaining independence and also mobility. And like we covered earlier, as we get older, our protein, calcium, and vitamin intake requirements actually increase. So it's certainly not too late. And now is the time to really focus on ensuring that these nutrients are being met in particular. So remember, it's never too late to make small changes Small changes can make a significant difference and improve your eating habits through better nutrition. So that concludes our myth busting for today. Dietitians are a reliable source of evidence-based nutrition, so always reach out to your dietitian for support. We have 18 expert aged care dietitians around Australia to help your residents. We can help your aged care home by providing one-on-one consultations with residents, menu development and review, educational sessions, malnutrition screenings, supplement reviews, and the nutritional management for dementia. Within our Malgrave Clinic, our dietitians are available to help one-on-one for a range of reasons, including cholesterol, women's health, weight management, IBS, Crohn's and celiac disease, diabetes management, and sports nutrition. So our team is always here to help everyone of all ages, and we can also conduct telehealth appointments if you're unable to come to our clinic. We're always here to help you. So thank you everyone for joining, and thank you for all submitting your suggestions. I hope you found this session interesting, and if we didn't cover your myth today, don't worry, because we will be having webinars coming up to cover all your amazing suggestions, and this webinar has also been recorded for view to come onto our website. So thank you all for joining today, and I'll finish up there. Have a nice day.